We can overcome the giant with simple means. Listening to people and sharing our stories, something Goliath is not good at. As you knock every door, Canvassing was created in the wake of the 2016 election by former Bernie Sanders staffers and other progressives. A similar system had been used to raise Mr. Sanders from name recognition of 3% in 2015 to winning 47% of the delegates in the primary in 2016. And so the National Nurses United has adopted that method of going knocking every door. And it is a very simple, relatively stress-free method. You don't have to look on the van and see which door to knock on or send in complicated reports on the political aspects of it. Your main goal is to listen. And you introduce yourself and then listen. That's pretty easy on you and on the person at the door. In our experience, there's been someone home about half the time. And of those who come to the door, about half are willing to talk, to tell you about their experience with the healthcare system. If nobody's home, just leave a bookmark or some other form of literature specific to what you're interested in. And one of our most active volunteers in Corvallis now is a woman who wasn't home when we were canvassing in her neighborhood for city resolution. She came home the next day and saw it, and she called us right away. She had been in finance at HP a few years before, had a headache, felt nauseated. She was going to drive herself home, and she got halfway there and said, "This serious headache, and I have insurance. I think I'll go to the emergency room." She was having a ruptured berry aneurysm. So when they took her into the ER, they life flighted her to Portland, and 3 years later, she gets this little bookmark on her door. She remembers that had she not had access to healthcare, she would not be alive. She is now chair of our finance committee at Mid-Valley Healthcare Advocates.
Here are some ideas to help you get started in organizing a canvas in your area. Go to the Healthcare for All Oregon and Healthcare for All Oregon Action website, and then up in the right upper corner there's these little 3 bars, and click on those and you will see some options here. Go to Act and you'll see a list of things, and at a later time come back and look at Speak Up. That talks about messaging and public speaking and so forth. But right now we're focused on canvassing, and the canvassing section is currently housed under tabling. It may have a tab of its own later, but right now it's under tabling, and at the bottom you see canvassing. And so you can click on Knock Every Door guidelines, and you will see just a narrative of why we're doing this and about Knock Every Door and canvassing techniques, the simple method that it uses, how to start your conversation, how to listen carefully, acknowledge the person's concerns. Then after you ask them to tell their story, you follow a response. First, you listen, and body language is important. As you can tell, make good eye contact, smile, don't interrupt them, and then be sure you're hearing their main concerns. Then after they have spoken, then you acknowledge that you've heard their concerns, and then you tell your story in a way that matches their concerns and in some ways may answer some of their concerns. During the canvassing, usually we do it for 2 hours. About half of the people have been home in our experience. So this was a canvas we did in early December 2018. And if they're not home, then we leave some literature. Here's a bookmark that tells about the situation of how people are suffering under a healthcare system and how to get in touch with us if they want to help correct the problem. And then if you sense that the person is sympathetic at any point, ask them to sign on to a form you see here. And the form will look like this, with the name of the canvasser at the top, where the canvas was, and the date, and then the contact information for the person you're talking with. And 4 questions actually. Do they have a healthcare experience that they're willing to share? Yes, no. Are they willing to be listed as a supporter of universal healthcare? Would they be willing to accept a phone call to keep them updated and get them involved? And are they a Spanish speaker? So then you send this information in to your data person for your local chapter, or if you don't have one, send it into Healthcare for All Oregon, and then also to National Nurses United. And there will be instructions on how to do each of those. Back to the HCAO website. So under those guidelines, there are forms that you will get, and you can download them from here or get them from Healthcare for All Oregon. So the first one that you might be interested in is the host guide. So if you're leading a Canvas or just want to be prepared, you go here and click on that. And it shows you the background of why we're doing this, and what we expect to accomplish, but also how to prepare. So it suggests choosing a Saturday or Sunday. That's when you'll more likely find people home. Obviously, recruiting canvassers is a key element in the success of your canvassing. So you first of all start out with emails to them, but you really can't expect that to be enough. And you can picture being invited to a party by email and nobody calling you. You're likely to put it on your calendar, but not likely to go. But here's you can find this form in the packets that you can download, but KnockEveryDoor hosts packet. So you click on sample description and it shows you what you could send, an email. And it says National Nurses United and KnockEveryDoor, and we can add Healthcare for All Oregon. Need your help. Join us on the given date to canvass in the city that you live in. We'll go door to door talking with our neighbors about Medicare for All and ask for their support. So you send that email, but you follow up with an RSVP, and you can do that either with Eventbrite or other systems, or simply request the RSVP here. So send that out, but then follow up with a phone call, calling people and make sure they come. So you can see what effect you have by calling. Very effective. Texting is pretty good too. Facebook is pretty good. They don't even mention email. So please follow up with a personal contact. Then you have them come to your event an hour before your canvassing, and you go over the plan, you role play, you look at each of these forms that need to be filled out, and then you're on your way. Here's how you prepare maps for canvassing. You go to Google and look up in the upper corner here, and you see those 9 dots, and you click on that, and you will end up with these 9 icons, and you choose Google Maps right here. Then you will find your area. This happens to be Corvallis, and you just keep honing down on the neighborhood that you want to focus on. So we're pretty much downtown Corvallis here. And so we're at about 1,000 feet elevation, looking down on a neighborhood. So you see those houses there. So we print out maps for each of those blocks and then assign groups of 2 canvassers to each block. So after we stop at these houses, we put little notes on what we found out. So there's Mike and Stan stopped there. Nobody was home on those 2. We talked with a young woman there, and there are a few people here. Most of them were not home. We talked with a person in that house, and we got 2 of them to sign there, and here also. So anyway, you record that, and then when you get back after you're done, you tally the number of places that you knocked doors on and how many conversations you had, partial conversations, and how many people signed on. So this is photographing the list of canvassers. Then photograph all of the forms with data on them and send them by email to your local data person or HCAO.org, but also send it to data@knockeverydoor.org. Make sure you've done all that you need to do. Now you've had a chance to review how to canvass and how to organize a canvass. KnockEveryDoor canvassing is easy on the canvasser and the one being canvassed because it focuses on listening rather than selling an idea. We think you'll find canvassing satisfying and often fun. People who answer the door are most often willing to talk. We just need to be ready to listen, share our stories, and then ask if those we talk with want to help create a much improved healthcare system. Everybody in, nobody out.